Thanks everyone for attending. I just wanted to say that so I'm a glaucoma specialist and cataract surgeon based in Melbourne for over 10 years now. But I actually spent a couple of years doing my glaucoma fellowship in Wellington with Professor Tony Wells. So New Zealand actually holds a very special place in my heart. So anyway, I just wanted to start off by saying that my father has glaucoma. And so this means that I am at risk of getting glaucoma. And like everyone else who's watching, I want to do all that I can to reduce my own risk of getting glaucoma through natural lifestyle measures. And that has led me to do a lot of my own research, reading scientific papers, doing my own questioning of why things happen certain ways. And I'm very happy that I'll be able to share with you my blueprint, if you like, in this evening talk. So whether you're someone with glaucoma or you're at risk of glaucoma like myself, or you simply just want to look after your eye health, the next 20 to 25 minutes should hopefully provide you with enough information to empower yourself to make the best decisions for your eye health. So I coined the term proactive glaucoma care, essentially to describe the taking of proactive action to address and manage glaucoma risk. And this is through natural and holistic lifestyle measures. This is because the current guidelines in terms of managing risk beyond eye pressure is actually very passive. So for someone who is at higher risk, like myself with a family history, the recommendation is to just get my eyes tested every 6 to 12 months, which is reasonable advice and good in the sense of screening. But it's so passive, it's like you're almost waiting for glaucoma to happen to you before you do anything about it. Whereas I prefer to step on the front foot and take proactive action, deal with the problem earlier and more decisively. So how do we achieve like proactive glaucoma care? And we do this by incorporating what I call the 5 key pillars of proactive glaucoma care. And these are physical activity, stress management, sleep, nutrition, and finally, neuroprotection. So I have it in an infographic form. So the 5 key pillars. And let's start with the physical activity, the first key pillar. So aerobic exercise is probably one of the best things that you can do for your eyes from a glaucoma point of view. We know from studies that through aerobic exercise, you can get temporary reduction in eye pressure ranging from 1 to 6 millimeters mercury. The exercise also helps to improve blood flow to your eyes, to your optic nerve and your brains. And the studies have found that by doing more exercise, you can actually slow your rate of visual field loss by about 10% or so. So the recommendation here is to do moderate and brisk exercise for at least 30 to 45 minutes every day. And speaking of exercise, swimming is a fantastic non-weight-bearing aerobic exercise. So the only issue with swimming here would be with regards to the swimming goggles, because swimming goggles that are too small can actually press on the orbits and cause intraorbital pressure to increase, which also causes your eye pressure to increase. So therefore, when you go swimming, just make sure you wear goggles with a large internal diameter of at least 52 millimeters or more. The main issue with physical activity comes with strength training. This is because when you lift weights and you exert yourself, this increases intrathoracic pressure. And there are case reports where the increase in intrathoracic pressure could actually elevate the eye pressure by up to 40 millimeters mercury. So this doesn't mean you can't do weight training, but it just means that when you are when you're exerting yourself, don't hold your breath in. Instead of holding your breath in, just slowly exhale. It's a bit like you've got a pressure cooker and just releasing the valve to let the steam out. Also, instead of using heavier weights with less repetitions, then you do more repetitions with lighter weights. Another activity that could cause pressure elevation is actually through playing wind instruments. So people who play high resistance wind instruments like the trumpet actually had greater visual field loss compared to those who play lower resistant wind instruments like the flute. And this was related to how much time you spent playing these instruments. So where possible, especially if you've got advanced glaucoma, you may wish to reduce your hours of playing high resistance wind instruments. And yoga, I get a lot of patients asking me questions about yoga. I mean, yoga is a great activity which improves blood circulation, helps with mental health, helps with cardiovascular health, helps with musculoskeletal health. But it is the inverted positions that cause the eye pressure to increase. I had a patient whose eye pressures were normally stable at 10 millimeters mercury on treatment. And as soon as she did an inverted position, the eye pressure went up to 30 millimeters mercury within 30 seconds. So it just shows how rapidly the eye pressure can change through your positioning. So it doesn't mean you can't do yoga. It just means that if you have access to an experienced teacher or instructor who can help you to adapt the postures so that you can still reap the benefits of yoga, but without having these pressure rises that can be harmful to the eye. Now, one of the great things about yoga, of course, is that it helps to improve stress levels. And this actually forms the second key pillar of proactive glaucoma care, managing stress. I personally feel that stress is criminally overlooked when it comes to treating eye problems. We know that stress is associated with elevated eye pressure, elevated blood pressure, which in turn increases your risk of retinal vascular conditions, central serous retinopathy. A lot of conditions are associated with stress, yet we don't spend enough time talking about it. So with stress, obviously, it is impossible to live a life of no stress. But what we can do is to have a strategy to manage this stress. And one of the best ways of managing stress is through mindfulness meditation. So from a glaucoma point of view, meditation has been shown to be able to reduce eye pressure by up to about 25% if you do it daily, 45 to 60 minutes. Now, I know that meditation is not the easiest thing to do. So you have to start small. So if you want to do meditation, maybe start like 5 minutes a day. And once you get good at doing it, then you gradually increase the length of time you spend doing it. If meditation isn't your cup of tea, then I was very pleased to read a recent publication on 365 breathing. So 365 breathing was recently shown to be able to reduce eye pressure by an average of 2 millimeters mercury and also reduce circulating stress hormones and blood pressure as well. And this is very simple to do. So the 3 just means you do it at least 3 times a day. 6 just means you take 6 breaths every minute. So you slow down your breathing. And the 5 just means you take 5 seconds to inhale and 5 seconds to exhale. So this is something that is very simple to do. You can do it anywhere. It's free, it's low risk, and you don't need any specific guidance or equipment to do. And I highly recommend doing it, especially when, like me, you're stuck in traffic and you just feel your blood pressure rising, your blood boiling. And this is a great way to calm yourself right down. And this leads on to the third key pillar, which is restorative sleep. I mean, sleep is so important because this is the time that your cells rest and rejuvenate and recover. So you want to aim for 7 to 9 hours of uninterrupted sleep every night. Too little sleep is no good, but too much sleep is also linked with glaucoma. So don't sleep more than 10 hours a day. Now, with the sleeping position, there's quite a bit of debate on this because you might want to um, sleep comfortably, but when you know that lying down flat could also elevate the eye pressure. So from my point of view, I prefer to prioritize good quality sleep. So if it means lying down flat, so be it. Just don't sleep with your face down with the affected eye pressing into the pillow. You could elevate the bed head, and studies have shown that that could help to reduce the eye pressure, but you should also elevate not just the head or the neck, but also the torso as well. I find that extremely uncomfortable, so I don't do it. And finally, sleep apnea is very important. So if you have sleep apnea, please treat it, because people with sleep apnea have a tenfold increased risk of developing glaucoma. And this is due to the oxygen supply to the optic nerve being compromised, and also you tend to get multiple eye pressure spikes as a result of repeated airway obstruction. Next, we go on to nutrition. It is well known that a healthy and balanced diet is good for your body and also good for your eyes, good for not just glaucoma, but also other eye conditions such as macular degeneration. So the population-based studies have confirmed that people who consume more fruit and vegetable servings per day are up to 79% less likely to have glaucoma. Dietary intake of vitamins A, C, and E, when combined together, are also associated with reduced risk of glaucoma. So make sure you eat plenty of fruits and vegetables in your diet. The Mediterranean diet is a perfect type of diet to have for protection against glaucoma. Similarly, dietary intake of omega-3 fatty acids also play an important protective role against glaucoma. So eat more fatty fish such as sardines and trout, and try and reduce omega-6. And you get omega-6 from a lot of sort of processed foods and industrial seed oils. Yeah, some studies have found that it is the proportion that's important. So you want a higher proportion of omega-3 and a lesser proportion of omega-6. What you put in your body is not only just limited to the food you take, it's also what you drink is also important. So a study from the United States found that people who drink a daily cup of hot tea actually had a reduced risk of developing glaucoma by about 74%. If you drank iced tea or decaffeinated tea, there was no impact on glaucoma risk. So that was really interesting. So this study did not specifically record the type of tea you should drink, the cup size, or the brewing time. So what this means is that for now, please feel free to drink whatever brew it is that you love drinking, be it matcha or chai or Earl's Grey, as long as it is not coffee, because coffee has been shown to be able to increase the eye pressure, albeit temporarily, by up to 1 to 6 millimeters mercury. So this can be quite significant. And the latest study has shown that if you are at genetic risk for developing glaucoma, such as myself, then if you drank more than 2 cups of coffee a day, that would increase your risk of glaucoma fourfold. So with coffee, the key is to drink in moderation, so no more than 2 cups per day. Alcohol, on the other hand, causes a transient reduction in eye pressure. But before you rush off to drink lots of alcohol, um, a meta-analysis of multiple studies have found that long-term alcohol intake has been associated with glaucoma, even at intake levels below the current UK and US guidelines. Furthermore, too much alcohol can cause non-glaucomatous optic nerve damage through toxic optic neuropathy due to ethanol toxicity. So again, with alcohol, the message is to drink in moderation. So up to 1 to 2 glasses of wine per day should be okay. And of course, there are things that you should avoid altogether. So foods with high refined sugar and saturated fat content, try and cut that out altogether. Don't try and take it in moderation. There's no such thing. Highly processed foods, try and cut that out. Smoking, please don't smoke in moderation. Just don't smoke, full stop. The studies have found that smokers have a 70% increased risk of developing glaucoma compared to non-smokers. In fact, I can't think of any other thing that you could do that would increase your risk of all the major sight-threatening conditions of the eye than smoking. Only smoking does this. So if you've got glaucoma and you smoke, the single most important thing you could do is actually to cut down and stop altogether. And now, this leads me to the fifth key pillar, which is neuroprotection, which also happens to be my favorite part. So neuroprotection just means protecting the nerves. And in the context of glaucoma, it's protecting the nerve beyond reducing eye pressure. And this is because we know that while eye pressure is the major risk factor for glaucoma, it is not the only risk factor for glaucoma. There are at least, 9 other key risks that need also to be addressed. So if you think of it as you've got a ceiling and you've got 10 holes that are leaking, and the largest hole is called eye pressure, and you've patched that up, which is great, but you've got 9 other smaller holes that unfortunately we are not patching up most of the time. So we should also actively address this. And the reason this is an exciting area is because we used to think that when you're diagnosed with glaucoma, it's a downhill journey all the way. It's just a one-way street towards losing vision. But the studies now, I think, show more promise that if you're able to target the specific biocellular risks and mechanism correctly, then we could not just halt the disease progression, but potentially even restore some function. Let's go into these one by one. So with eye pressure, we know that it is the most important risk factor. But did you know that beyond eye drops, laser, and surgery, there are also botanical extracts that are able to help to reduce eye pressure? This is on top of what you can achieve with your existing treatments. So studies have found that plant extracts such as saffron and the combination of maritime pine bark and bilberry, and also palmitoyl ethanolamide, are able to reduce eye pressure by 1 to 3 millimeters mercury. And while this is not significant if your eye pressure is 30, and it can't be used to replace your existing treatment, I think it's a great way to complement your existing therapy to bring down pressure even more. The second risk is mental stress, and we already covered that earlier on. And as I said earlier, this is because it increases eye pressure, blood pressure, cardiovascular risk. And there are plant extracts that can help to calm the mind down. And these are called adaptogens. And the most well-known adaptogen is actually saffron, which has been used for centuries in traditional Ayurvedic and Persian traditional therapy for helping to calm the mind. Now, the next risk is homocysteine levels. So homocysteine is actually an amino acid that is naturally present in the body as a result of amino acid metabolism. So everybody has homocysteine in their body. It's when the homocysteine levels are high that it becomes a problem, because these can affect the blood vessels that supply the eyes, the heart, and the brain. So when homocysteine levels are high, you're actually at increased risk of having, cardiovascular disease, increased risk of stroke, and from the eye point of view, increased risk of developing pseudo-exfoliation glaucoma. The other forms of glaucoma, the link with pseudo-exfoliation is a little bit less clear-cut. So to reduce homocysteine effectively, the three main vitamins that you can take are methylcobalamin, which is the active form of vitamin B12, methylfolate, which is the active form of folate, and pyridoxine, which is vitamin B6. Now, hand in hand with elevated homocysteine levels is vascular dysregulation. So essentially, it just means that the blood flow and the circulation to the optic nerve and the eye is impaired. And so that means that your optic nerve cells are not receiving enough oxygen and enough nutrients to function at its optimal level. So you would want to improve blood circulation and blood flow to allow optimal functioning of your optic nerve. And the two most well-known plant extracts that help with this is ginkgo biloba and bilberry. And in fact, there are several retrospective studies that have found that people who take ginkgo biloba and bilberry actually had a reduced rate of visual field progression, and in certain cases, even improvement in their visual fields. Now, we talk a bit more about the cellular side of glaucoma mechanism. So, mitochondrial dysfunction is something that is more recent. And I should probably explain a bit more about what the mitochondria are. So the mitochondria are basically the batteries of the cells, and they're important because they generate energy for the cells to function. And they require NAD plus to function. We know that as we grow older, the levels of NAD plus in our body and our eyes deplete. And when this depletes significantly, it actually reduces mitochondrial function in the eye and accelerates retinal ganglion cell death. So in order to protect the cells on a cellular level, we need to increase NAD+. And by increasing NAD+, we restore mitochondrial function. And the best way to do this is with nicotinamide, which is a form of vitamin B3. So not niacin, but nicotinamide. Now, some of you might have heard about NMN, which is nicotinamide mononucleotide, or NR, which is nicotinamide riboside. Now, these are different precursors of NAD+, but they are not as good as nicotinamide because they are not as bioavailable to the retinal ganglion cells as nicotinamide. So if you want to take B3 to improve your NAD plus levels and restore mitochondrial function, for the eyes, nicotinamide is the form that you need to take. Hand in hand with mitochondrial dysfunction is actually impaired glucose metabolism. So the lab-based studies have found that glucose metabolism and glycolysis are actually impaired when the eye pressure is elevated. And when this impairment goes on long enough, then you get optic nerve degeneration, which is why there's quite a lot of focus on trying to restore the glucose metabolic pathway and the glycolytic pathway. And the best way of achieving this is actually by supplementing with pyruvate. In 2022, a short clinical trial was published where open-angle glaucoma patients were given nicotinamide and pyruvate in combination. And they actually found that this combination was able to improve visual function over the short term, only 2.2 months. But the concept is there, and it is very exciting to see what would happen, over the long term when you take both together. So when you get mitochondrial dysfunction and glycolysis defects, if that is not addressed, then that leads on to oxidative stress and chronic neuroinflammation. And these increase the susceptibility of your nerve cells to damage. So you would now want to take certain nutraceuticals to try to limit this free radical damage and the negative impact of inflammatory processes. So the best antioxidants and anti-inflammatory supplements that you can take include ginkgo biloba, bilberry, grapeseed, and saffron. Downstream to that is axonal degeneration. So the axons are the part of the retinal ganglion cell that transmits information from the retina to the brain. And when you have degeneration, obviously the signals are not being transmitted to the brain, and this results in loss of function and axonal transport failure. So the axons are very important to protect, and the nutraceuticals that are able to help to protect the axons and help with their function include vitamin B12, methylfolate, and also acetylcholine. There was a study from Japan that showed that people with normal tension glaucoma who took methylcobalamin over the long term for about 4 years, their rate of progression was actually much less compared to those who did not take methylcobalamin. And finally, macular pigment deficiency. So macular pigment deficiency is typically associated with macular degeneration. But more and more now, we recognize that people with glaucoma also have low macular pigment. And this impacts on their central vision, their contrast sensitivity, and potentially also their central visual field. So the two main macular pigments that comprise the macular pigment are lutein and zeaxanthin. And we are not really able to get enough of lutein and zeaxanthin from our diet, and this is why we need to supplement. So after all that, the next question I get asked a lot is this: which neuroprotection risk should I address? Well, currently, there is no medical consensus or specific guidelines on neuroprotection. So this is an area of contention. For me personally, as someone who is at risk, I would want to cover all the risks and mechanisms. I don't want to leave things to chance. I just want to cover everything. But of course, ultimately, what to address, what you take, how much to take is your decision after you discuss this with your eye doctor. Please remember that any supplements that you take must not replace your existing prescribed treatments. But I will share with you my neuroprotection protocol that I recommend to my patients. So here you've got 10 key botanical extracts and activated vitamins. Ask them to take bilberry, ginkgo, grapeseed, methylfolate, lutein and zeaxanthin, methylcobalamin, nicotinamide, pyruvate, and saffron. So I thought I would also share with you some of the case studies of my patients who are on this neuroprotection protocol. So this is the visual field test of a 45-year-old male. He has normal tension glaucoma, already had SLT treatments, and is on eye drops, but his left visual field was deteriorating. And once I discussed with him about neuroprotection, he decided that he would go on it. This is the visual field test 9 months later, and where he took the neuroprotection protocol for the last 6 months from the field test, and you can see highlighted in red circles where the visual field defect had subsided. So this is that 45-year-old man. This second case is a 54-year-old female. She also has normal tension glaucoma and is on topical therapy. Pressure is 10. You can see that her visual field loss is mainly paracentral, and the top part of her central field is significantly affected. A year later, when we repeated the visual field test, she had been taking the neuroprotection protocol for about 4 months, and you can see that the amount of paracentral loss purely had actually decreased. And finally, this is a 67-year-old female with much more glaucoma damage. She already had surgery with eye stent implantation, and pressure was 10. And you can see a significant inferior field loss, very dense, and also superior paracentral loss here. This is her visual field test 6 months later. She only started taking the neuroprotection protocol 2 months prior to the second field test, and you can see that the amount of paracentral loss has decreased, as evidence on the red circle. So in summary, proactive glaucoma care requires proactive action on these 5 key pillars, which is physical activity, stress management, sleep, nutrition, and neuroprotection. And it takes hard work, and you got to persevere and be consistent, but I can honestly say that it is definitely effort that is very worthwhile if you can go through with it and be consistent. Finally, just wanted to say that I've got a complimentary ebook where I discuss a lot of what I've discussed here today, and it's available as a free download. All you need to do is just to scan the QR code. Well, thank you very much for your time and attention. I'm very happy to answer any questions. If you can't think of any now, but you want to email me later, I'm very happy to take questions by email as well down the track.
Is there a particular brand, would you know? I know it's a random question, but
it's not the brand that's important, but more the size. And
the size.
in fact,
Yeah.
the safest ones are the snorkeling goggles, because they cover both eyes in one single piece. But obviously, you look a bit silly.
Is decaffeinated coffee okay? Is that cause less damage?
I think it's fine, and if you don't mind drinking tea, just swap to tea, because I don't think there's any data on decaffeinated coffee, but there's definitely data on tea. So if you don't mind, then just swap over to tea.
So you spoke of smoking. What about vaping?
Vaping is equally bad.
Equally bad?
I'd say that the marketing for vaping has been enormously successful, and sadly so. But yes, no smoking, no vaping, please.
There are lots of supplementation suggestions. Is there any eye care supplement which covers several of these?
My colleagues and I, we actually realized that the list is quite overwhelming to a lot of people. So we actually developed our own one, and that's called NutriVision, where we have everything already in one capsule. So, but I wanted to list everything out here so that I wanted to be as transparent as possible. So people can choose to take them separately, or they can take them in the combined capsule. It's totally up to them.
Do the specialists in New Zealand, like mine's never suggested anything like that to me. Are they on board with it, or is it something new to them?
So this is why I said that this is quite a contentious topic. And there are, I mean, these supplements, they have been shown in clinical trials to be beneficial. I think one of the issues is that the clinical trials may not be large enough for my colleagues to accept and then to recommend it on a large scale. So for me, I'm realistic, because I know that if you wanted a large clinical trial that has, say, 10,000 participants in it, unfortunately, we know that this just isn't going to happen. And so we just have to take action based on what we know right now with the existing data that we've got. So it's the same in Australia as well. Not many of my colleagues share my philosophy on this proactive glaucoma care, where to me it makes perfect natural sense to employ natural lifestyle measures to reduce risk, but we just simply don't talk about it enough to our patients.
Because those clinical trials have been quite limited, have they shown any adverse reactions that people would be concerned about?
Yeah, so that's the great thing. These trials haven't shown any adverse reactions at all. And because these are not medications, these are natural plant extracts, they are activated vitamins. These are things that you can already get from a health food store. Yeah, so it's not like it's some kind of experimental thing that you're taking for your eyes. So I personally feel that there is not a lot to lose, but actually potentially a lot to gain. And the reality is that when I formulated this supplement, it was really just, actually I formulated it for myself. It's really to protect myself, reduce my risk of getting glaucoma, and also for my father too. So for me, I won't ask someone to take something that I won't take myself. I'm taking it myself because I really believe that in the current data that we have, and I really believe that it will help me.
Another one, if the supplements lower the pressure and the eye drops do as well, can it go too low and have other ramifications?
So the eye pressure should not go too low that it is unsafe. The only way the eye pressure goes too low is if you have surgery. So eye drops on its own, or the supplements on its own won't really reduce the eye pressure to a dangerous level. Because if you remember in one of the slides, I showed that the eye pressure could only drop by an additional 1 to 3 millimeters mercury. So that's generally not, it's not going to be so significant that it will cause vision problems due to low pressure.
Another question, which is a good one actually, will the same supplements help with macular degeneration?
Yes, yes. And that's because these processes that contribute to retinal nerve fiber degeneration also contribute to macular photoreceptor degeneration. So my opinion is that taking these will also help with macular degeneration because they are broadly these ingredients are broadly targeting the aging processes that happen in the eye.
Another question from Marie, would you take these supplements on the dosage recommended on the bottle? I did see in a study on nicotinamide, a much higher dose than recommended was used.
That's a great question, and that was one that we were thinking quite a lot when we were making the supplement, and we used a reduced dose because we realized that, at least clinically, my patients, because the trial, they looked at a dose of 3,000 milligrams. That's a mega dose. And the recommendation is not to exceed 3,000 milligrams. So some of my patients, well, actually a lot of my patients, when they took it, they actually couldn't tolerate such a high dose. They actually had nausea, indigestion. I had one patient end up with abnormal liver function tests. So I got worried because, not worried, but I didn't want to be in a position where people are taking mega doses for the long term, because with this supplement, you're going to need to take it over the long term. It's not just you take it for 6 weeks and you're going to be okay for the rest of your life. You're going to have to take it long term. So I worry about the ramifications of taking mega doses over the long term. And so I went and looked at the clinical literature for nicotinamide, and I found that at a dose of like 500 milligrams, it was able to have an impact on reducing the risk of non-melanoma skin cancers. So even at a dose of 500 milligrams. So my thinking is that given that it is so bioavailable to the eye, if it is able to have a clinical effect on skin at a dose of 500 milligrams, it should also have an effect on the eye at a dose of 500 milligrams over the long term. I have no data to prove this, but this is just based on my sort of clinical extrapolation, if you like.
We have got a question, which I think is a good one. How do we get your supplement, Brian?
Yes. So this is something you can get it online, and I might just type it out here. Just intravision.com.au, and we do deliver overseas, and if I'd be very interested to see how you go if you decide to take it, because at the end of the day, it's about improving people's prognosis with glaucoma, and if we can reduce the rate of vision loss, then this would be good. The more people know about it, the better it would be.
Yeah, absolutely. Would you be doing more research around it?
Yeah, so actually, I just recently completed an audit looking at the patients of mine who are taking this. And I found that in those whose eye pressures are consistently 15 millimeters mercury or less, 81% of them actually showed some improvement in their visual field in at least 2 of the 3 visual field indices. But that also means that the remaining 19%, they were still progressing or deteriorating, but albeit at a slower rate, or they might be progressing due to some other condition. So the key is still that we have to maintain good pressure control at 15 or less. And when the eye pressure control is good, it creates the conditions where the supplement can then achieve its optimal effect. So I'm also in the process of working with CERA, the Centre for Eye Research Australia, looking at how the supplement makes a difference in various new imaging techniques. But the data for that is going to be quite some time before we get it. One thing I will say is that just be aware if you have low blood pressure, because the Nutrivision supplement can reduce blood pressure. If you've got high blood pressure, great, it will help to reduce your blood pressure. But if you already got low blood pressure and you're taking medications, you may have to measure your blood pressure, and you may have to cut down on your blood pressure medication. So that is just something to be aware of.
And manage carefully with your
eyesight. Yeah, that's right. Yeah.
Yeah. We've got a message now from Marie. I was under the impression that once there is visual field loss, it's gone for good, but it seems there could be some hope.
Yeah, I want to sort of touch on that actually. So the optic nerve is not just one optic nerve. You've got hundreds and thousands of smaller nerve fibers. And these nerve fibers are in varying states of health. You've got healthy nerve fibers, you've got sick nerve fibers, and you also got dead nerve fibers. Obviously, the dead nerve fibers, you can't do anything about that. So with neuroprotection, it's about keeping the healthy nerves strong. And also, you want to target the sick nerve fibers. You want to be able to prevent them from dying, but also you want to feed them with the nutrients it needs to strengthen themselves and recover their health. And when they recover their health, then you would find that their function would also improve. And I think this is the basis of the visual field improvements that you see in those examples I provided. It's because the sick cells, we have managed to restore their health, and by restoring their health, they're able to recover their function. Now, please be realistic and don't expect that all the visual field loss will be recovered, because that's just not possible. So the way I see it is that the visual field loss will improve and to a certain point, and then you reach a ceiling and it won't get better anymore. It will just stay as it is. So that's how I envisage the neuroprotection to work. So it will help to improve, and then that's it. You can't hit a certain point and you can't get better anymore.
I think of it as gardening. Once the plant's dead, it's no point feeding it. So
I love that analogy. That's a great analogy, actually. I think I saw one about someone asking about 15 years after trabeculectomy. Is it safe to have cataract surgery?
Yes. Is it safe to have cataracts? Yeah, a general.
Yes, I would say yes. You just be aware that any surgery can have an impact on the trabeculectomy. And so what this means is that we have to take extra steps to maintain the functioning of the trabeculectomy. And that could either be by injecting special anti-scarring medications at the conclusion of the cataract surgery, and also close follow-up afterwards. And at least in my practice, so if you've had trabeculectomy and you're having cataract surgery, I would give either a 5-FU injection or mitomycin C injection at the end and see in a week. And I might just give 1 or 2 more 5-FU injections in the clinic, just to make sure that the scarring process does not start and cause the trabeculectomy to fail. So yeah, it can be a tricky area, but I think with the right management post-operatively, you should be okay. So please go ahead and have the surgery is my message.